Do you really wonder why every time you are having back pain, especially on the side or on the side, each time you go to the hospital, the solution is not, given, or the problem is not being solved? So let's talk about kidney stone today. Kidney stone is the formation of crystals when minerals combine with salt, minerals such as calcium combine with some salt considered oxalate or phosphate. When they are combined, they form a hard substance, solid substance called crystals that will form itself stuck within the kidney, preventing the kidney from filtering urine properly, and this will cause severe pain. So what can be symptoms of this kidney stone? We said it, the back pains. So the back pain will be right below the ribs, here and here, most likely. It's either one sided or both sides, depending where the stone is located. So the back pain sometimes radiates, it can come down to the lower part of the stomach here. Another symptom can be you will have a very burning urge to urinate, severe burning urge to urinate, followed by feeling of vomiting and vomiting. So usually anything that interferes with the kidney can often cause symptom of vomiting, feeling of vomiting and vomiting as well. So followed by symptoms of fever if infections are associated. So you have fever and chills, vomiting, which will also follow when infection is associated with the kidney. But if no infections, you will have no fever. In men, symptoms of testicular pain. You will have the pain radiating. We say it can come to the stomach, right? And then it can radiate to the scrotum, to the testes. One more symptoms that we experience is bloody urine. Bloody urine, not often always a sign of kidney stone. Do not get me wrong. Sometimes you have bladder stone, you have other stones in other part of the urinary system. But most times the symptom of bloody urine can be kidney stone as well. So let's get that clear. You have also a foul smelling, very bad odor in your urine. Most times you see the urine cloudy. Even if you drink enough water, you see that urine cloudy upon testing in the laboratory. So kidney stone is something that can be treated. But how do you identify this kidney stone? You will do ultrasound of the stomach. And when you do your ultrasound, the ultrasound will identify the stone within the kidney. Then they're going to give you solution as to how to go about this. But how do we prevent kidney stone? The most important solution is proper rehydration. Drink enough water. Drink as much as you can. Drink 2.5 liters and above. So drink enough that will help your kidney to flush out the stones. But if the stones are very, very large, then the next option is surgery to remove it, which we don't want. So preventive measure: drink enough water, eat more different form of vegetables. Eat different form of vegetables that contain more calcium, because once the calcium concentration is less within you, it puts it at risk of bonding to other minerals like the salt. So kidney stone is real, it's very serious. Let's take it seriously. Make sure you do your ultrasound. When it comes to treatment, you will be treated by your doctor or physician assistant who saw you. So get it today. The symptoms you are having could likely be kidney stone. So go and do your ultrasound and make sure that it is identified. Then the earlier the better. You don't want to have a large stone so that you won't go for surgery. So get through the preventive measures. Some people don't let it drink at all, which is very bad. So please, let's follow for more. Thank you.